All right, ladies and gentlemen, join me as I bring to you a very special person, very beautiful, eloquent, knowledgeable. She's a doctor, she's a lecturer, a physician who is going to take us through another segment this morning. She is no other person than Dr. Mrs Aregbesola. Is doctor in the house?
Yes, God bless you. Good morning to you, my sister.
Good morning, man.
How are you? God bless you. How do you do?
I'm
Thank
fine.
you very much for that. Thank you so much for that wonderful introduction. I really appreciate you. Happy New Year to everyone.
Happy New Year, ma.
I wish you a
Happy
New
Year to you, ma.
The Lord
Amen.
prosper you this year. The Lord will walk with all of you this
Amen.
year. The Lord
Amen.
will partner with all of us this year. This year we will
Amen.
all excel in all our businesses in Jesus' name.
Amen.
By grace, we started well. We shall end well in Jesus' mighty name.
Amen.
God bless us all in Jesus' mighty name.
Amen.
I want to use this privilege to appreciate FOHOW International for the wonderful opportunity. I thank God for the new year. We also appreciate God for every one of you. In fact, you always keep the ball rolling here. We love you so much. Thank you for FOHOW International. Thank you for the privilege you've given unto us to be imparting knowledge in this field and to be learning from each other in this field too, in this platform. I really appreciate you for the privilege. I also appreciate Madam Lin Zhang, Professor Dixon Low for the wonderful initiative. We appreciate you. I appreciate the ambassadors, Ambassador Ibikunle Olawale Wali, for everything you've been doing in this platform. You did not allow the fire for the company to quench. You did not allow the fire of your love here to quench. Thank you for being a very wonderful mentor, a consistent and persistent mentor. We really appreciate you, sir. Thank you for all you do. We also appreciate the couple ambassadors. We also appreciate the MC group, Professor Idea and Professor Bumi. Thank you so much for pushing for keeping, for not allowing the zeal of your enthusiasm in this field to be totally down. Even when it's not convenient, you wake up very early, you mentor everyone. We really appreciate you. I won't forget to appreciate all the lecturers here. Dr. Ganiya, thank you for what you do, my mentee. I really appreciate my wonderful sister and Pastor Mrs. Fowler. Thank you for all you do. I won't forget to appreciate all the lecturers, Mr. Mo from Ibadan. Thank you for the knowledge you are imparting every time. Thank you for teaching us more about networking. We really appreciate you. I won't forget to also appreciate the MC group here. The MCs, oh my God. The Lord will continue to bless you. The Lord will continue to enrich all of you. The Lord will continue to strengthen you more and more. All the DDD sharers, we appreciate you, and all the partakers, all those of all of you that are actually sharing DDDs, and all of you that are actually partaking in this program every day, buying your datas and everything. We really appreciate you. Sorry about that. We really appreciate you. This morning we are going to be discussing about fibroid, because I discovered that in most cases many of us don't know what fibroid is, and we actually don't know how to treat it. By His grace, with experience, we've handled several cases of fibroid in my clinic, and we've been having a lot of positive results. So today we are going to be discussing fibroid. I want you to understand the natural management and FOHOW support of fibroid, how you can actually handle fibroid and what fibroid is. Okay? The presentation we help us understand what fibroid is, why it occurs, its symptoms, natural ways of managing it, and how FOHOW product can actually help you support the body naturally so that you won't grow fibroid. If you know what to do, by His grace, I'm very sure that, in fact, our children that are just laid, that are still growing, our ladies that are growing, our young girls that are growing, you will be surprised that if you put in all this lecture into consideration, by His grace, they won't develop fibroid. So, introduction, Bumi, are you there? Fibroid is one of the most common reproductive health challenge faced by women today. Many women are living with fibroids without knowing they have them, while others are actually suffering silently due to a lack of proper information. You know, fibroid actually affects married women, single women, women who want children, women who already have children. Understanding fibroid helps us make better health decisions and prevent complications. Yes, let's go further. What is fibroid? Fibroids are common non-cancerous growth of the uterus made of muscles and connective tissues. They may be single or multiple, small or large, and can cause heavy bleeding, pelvic pain, frequent urination, or fertility challenges. Fibroid growth is influenced by estrogen and often reduced after menopause. It is made up of muscle tissue, fibrous tissues. Fibroids are not actually cancerous. They are benign tumor, but they can cause serious discomfort and health challenges if not properly managed. They can be very small, they can be very light, they can be single, they can be multiple. Where do fibroid grow? Fibroid grow in different parts of the uterus depending on their types. Some grow inside the uterus, inside the uterine wall. Some grow outside the uterus. Some grow inside the uterine cavity. The location of a fibroid often determines the symptoms a woman experiences. Types of fibroid. There are 4 types of fibroid. We have intramural fibroid. Those are the ones that grows within the muscles of the uterus. Okay? And this is the main common type. That's the common type. We have subserous fibroid. This one grows outside the uterus and may press the nearby organs like the kidney. When the fibroid is actually subserous, when it's outside the uterus, the organs around that part is having problem. In most cases, when you have a lady that urinates almost every 1 or 2 hours, please let the person go for scan. The person is likely to have subserous fibroid. And if the lady is always having pain at the 2 sides of the uterus, of the lower abdominal region, please let the person check. It's likely the person has subserous fibroid. And subserous fibroid grows very fast if the person is not living healthy. Submucosal fibroid grows inside the uterine cavity and often causes heavy bleeding. If the fibroid is inside the uterus, at the lower part of the uterus, very close to the cervix, it grows inside the uterine cavity. This one that grows down the uterus in fact, the lady the person affected is likely to be bleeding profusely. In fact, submucosal fibroid gives room to a lot of terrible bacterial infection, fungal infection. In fact, if the person is exposed to viral with immediate effect, the person will contract the viral infection. So submucosal fibroid is one of the most terrible fibroid people should have. In fact, it's not the type of fibroid anybody should have, because it will not even allow sperm. In the case of those that are waiting upon the Lord, if they are meeting, they'll be having cervical erosion. When they meet, it goes down. When you see the fibroid, when you feel the lower part will be very hard. And there is no way such a person can be pregnant. So that is submucosal fibroid. We have pedunculated. Pedunculated fibroid grows on the stall, either inside or outside the uterus. When you talk of pedunculated fibroid, it grows, it has a root. It has a root at the upper part of the uterus. In most cases, this type of fibroid normally affect the fallopian tube. If the root grows posteriorly across the fallopian tube, it blocks one of the fallopian tube. It blocks the fallopian tube at that side. And this one comes along with a severe pain. It comes along with pain. It's just like pendulum. You know your bell, the bell they ring in schools. The root is very tiny, but the head is big. That is pedunculated fibroid. Now, what causes fibroid? I want us to be fast so that we'll be able to finish. What causes fibroid? Fibroid do not develop from a single cause. They are the result of combinations of hormonal, genetic, lifestyle, and environmental factors acting together, okay, over time. The major contributing factors include hormonal imbalance. Hormonal imbalance, especially estrogen, which stimulate fibroid growth. In fact, may God help the women. May God help the women in Jesus' name. When you talk of this estrogen is a group of hormones, crucial for female reproductive and sexual development, primarily produced by the ovaries, but also this fibroid is estrogen is also produced by the adrenal glands and fat tissues. When you are adding weight profusely, you have to control it. Because if you are not married and you keep adding weight, it's actually detrimental. A lot of fat cells, when you have a lot of fat cells, it can help you produce excess secretion of estrogen. And when you have excess estrogen, my dear, you are likely to have fibroid. High estrogen level causes development of fibroid. Low estrogen level causes menopause. And when you enter menopause, because your estrogen level is low, if you are not living right, my dear, you are likely to have severe case of lumbar spondylosis. You are likely to have osteoporosis. You are likely to have, arthritis. You are likely to start having gouts. Pains on the wrist, pains on the ankles, pains that you cannot divine. That is actually due to excess, low estrogen level. So if you are not living right, if you are not eating what you need to be eating, if you are the type that takes a lot of cold water, you are the type that takes a lot of soft drinks, you are the type that cannot do without taking fried food or red meat or milk, my dear, expect fibroid. Because in most cases, children that has this fibroid, in most cases, many of them, those young ladies of between 18 and 25 that has this fibroid, I want to tell you the secret is that they were exposed to sexual intercourse early. They may not tell you. They were actually exposed to sexual intercourse early. If a girl is not exposed to sexual intercourse early, there is no way the girl can develop fibroid. That is one of those things. And when he is exposed to sexual intercourse early, at the early part of her life, and she's also taking soft drinks, she's taking oil, my dear, expect fibroid. And their own fibroid is always very, very terrible. Okay? So now let's advise our people not to take much all those rubbish again. Now, poor diets and unhealthy lifestyle include high intake of processed food, sugar, unhealthy fats. Please let us avoid that. Accumulation of toxins in the body, especially sometimes substances that mimic estrogen from plastic, cosmetics, and chemicals. Chronic stress which disrupts hormonal balance and weakens the body's natural regulation system. That is to tell you that if you are undergoing stress, please let us reduce stress. Let us ensure that our body is actually relaxing well. When your body is actually affected, probably with stress, with poor diet, expect fibroid. You now begin to wonder, how will stress now affect, cause the production of fibroid? Stress can cause it because it affects your adrenal gland. It affects your fat building level. You see that the fat is actually as built, the fat is actually being built up due to your unhealthy lifestyle. And this excess fat affect affect your adrenal gland. So adrenal gland also secretes some few amounts of estrogen. Hello, let's continue. Chronic stress, like I told you before, poor blood circulation reduces oxygen and nutrient supply to the reproductive system. When you are not having proper blood circulation, that's the reason why we keep telling all of us to be climbing our blood circulating massage machine every day. Thank God for the PMM challenge. You are massaging people everywhere. When did you massage yourself last? Especially the lower abdominal region. You use your palm. You just fix your palm under the navel, the point under the palm. When you measure that part from your navel, down your navel, you just measure your palm. Down part of the hand, please place the electrode pad there and massage regularly. You won't be developing, and that will help you service your reproductive system. At the same time, it will help blood circulation to the reproductive system. Genetic factor, where fibroid run in families. When in most cases your family has this in their gene, it has a lot of role to play in development of fibroid. So when your family has it, when you know that your hands, your mom has fibroid challenge, please start living right. I will soon tell you the type of fruit to eat that will not allow you to have fibroid if you are, and also to help our children that are still just growing. Age and reproductive stage, with fibroid being more common during reproductive years and often shrinking after menopause. One thing is that when a woman has fibroid before menopause, when the fibroid now came, when the person enters menopause, immediately when the person enters menopause, it has a lot of role to. In fact, the menopause actually it has caused low secretion of estrogen. That is one of the reasons why most of our women that enter menopause normally suffer from severe pain on their back. They will say, hey, I have pains on my waist. I don't know the cause of this pain. So it just came suddenly. It's because of low secretion of estrogen. When you have low secretion of estrogen, expect arthritis, expect all this, expect pains, expect rheumatic pains. So please, you have to live right. You have to take a lot of water. Thank God for magnetized water device. Our magnetized water device has a lot of role to play in helping you, because when you take magnetized water, it actually allows proper cleansing. Your body chemistry will be normal. You will be sound. You'll be healthy. The water will actually penetrate into your reproductive system very well. And this will also allow the recuperation of your reproductive system. It allows anything, in fact, it doesn't allow any abnormalities in your reproductive system. Another thing here is, when you early onset of menstruation, which increases lifetime exposure to estrogen. When your children of these days now, I discovered something about the children of these days. They normally enter, they normally start menstruation early. Even a child of 10 years, you have to start telling your child, please, you don't need soft drinks, so you don't need this, you don't need that. It will go a long way helping them. Because they started early, it also has detrimental effect on their health. Because of the lifestyle they live, because of what they are eating. I want this, I want that, I want minerals, I want this, I want that, I want video milk, I want everything. When they are taking it, they develop very fast. And their reproductive system also develop fast. So when your child actually started early, maybe at 10, please, I beg in the name of God, let the child start living right. Give the child a lot of what do you call it? A lot of herbs, a lot of herbal food, like cabbage, like carrots, like fresh tomatoes, like sesame seed, like flax seed, like cinnamon. You can actually blend your cinnamon plate, or probably soak your cinnamon in hot water. Let them be drinking it, my dear. When she gets married, at whatever she will not, in fact, she will not even develop anything like gynecological problems. Obesity and excess body fat. as fat tissues produces additional estrogen. You know, when you are obese, my dear, it causes development of fibroid. That is the reason why from the beginning, you need to start having what? You need to start working on your head. You need to do everything possible, a lot of exercise, a lot of sleeping, lying down on BCM, sitting on BCM, standing on BCM. You are not doing that for anybody, my dear. You are doing it to also help yourself. And even if you are a woman that you know you are still on, you are used, your period is still very regular, my dear, please start climbing that machine so that when you enter menopause, you won't have severe pain. Because if you are a woman now, your period is still coming and you used to have one severe pain at the back due to the onset of your period, or probably due to the prayer because you are on, my dear, you are likely to have that pain in the future. So you need to be eating cabbage every day. You need to be taking cinnamon every day. You need to be taking that same fruit every day. You need to be taking cabbage. You need to be taking fresh tomatoes. You need to be, in fact, it will go a long way helping you. Vitamin D deficiency, which has been linked to increased fibroid risk. If you are lacking vitamin D, this is the reason why we need to be exposing ourselves to the sun. When you expose yourself to the sun, my dear, oh my God, it helps you accumulate vitamin D. When you have vitamin D in your body, my dear, it will, in fact, without vitamin D, there's no absorption of calcium. You know, there is no way you won't have problem with your back, with your bones. There's no way the cartilage that fits your bones together will not crack when you are lacking calcium. If you now start taking calcium later, my dear, it may not work. If you start taking calcium when the problem is already there, the result may be very, very low. I'm taking calcium. I'm taking this. I'm taking that. I don't know why the thing is not going. The pain is still there. The damage had already been done. The damage has already been done. So you need to do everything possible to live right even from now. Chronic inflammation in the body encouraging abdominal tissue growth. Yes. Chronic inflammation. When you have chronic inflammation that you are taking medications for, those medications are also very toxic, especially chemical drugs. They are very, very toxic. And the toxicity of these medications also has a lot of detrimental effects, and it assists in building, in developing fibroid. Metabolic tissues such as insulin resistance, which may promote fibroid development. When you have metabolic problems, like let us assume that you have what do you call it? You are a case of you have a case of a pancreatic problem. Your endocrine and exocrine pancreas has problem. That means you are not really converting insulin very well to your sugar is not being converted to insulin that your body system needs. We are going to discuss all this later. When this is happening, my dear, there is a problem. It can also contribute in developing, fibroid. This is the reason why you need to be checking your sugar level regularly. Not until you break down, not until you are weak. Okay, please, let's go further because of our time. The role of hormones in fibroid. The role of hormone in fibroid, yes. Hormones play a central role in fibroid development. Estrogen support female reproductive health, but when present in excess, it stimulates fibroid growth. It increases uterine tissue thickness. It worsens symptoms such as heavy bleeding. That is fibroid for you. There is nobody that develops fibroid with a very good lifestyle. If you have a good lifestyle, if you be living right from the beginning, my dear, you can't develop fibroid. The liver is responsible for breaking down excess estrogen. You know, if your liver is actually not, you can now see. If you are the type that takes alcoholic drinks, if you are the type that takes beer, if you are the type that takes a lot of red meat, if you are the type that takes a lot of late night food, you finish eating, you just go to bed, my dear. You will stress your liver, you stress your organs. So the liver will not be able to break down those excess toxins from that food. It won't be able to actually. The liver is actually our laboratory. It's our body laboratory. It's our body filtration center. So when your liver is actually dysfunctioning, if you have dysfunction of the liver, my dear, one, you may end up with hepatomegaly. The liver may actually be enlarged. And at the same time, immediately you are exposed to a trace of hepatitis, you contact it. That is the reason why we need to be very responsible. We need to be living right in our own interest. When liver function is weak due to toxins, poor diet, and stress, what happens? Estrogen accumulates. Estrogen will now accumulate in your blood. So because the liver could not actually filter it very well. Okay? Hormonal imbalance occurs. Fibroids are encouraged to grow. That is it. Without a very good liver, my dear, there is no, with a very good liver, I mean, you can't develop fibroid. So anybody that has problem with the liver, that with fibroid, that is the reason why you need to give them more of cool down liquid. You give them cool down liquid. If the person is having ulcer, if the person is an ulcerative patient, you have to use time. Either you will give the person, you can even divide the bottle into like 4. 1 cup, the cup that came with the measurement cup of 20 ml, to about one bottle water immediately after food. You can do that. That will go a long way helping the patient. Are you getting my point? Now, this explains why detoxification and liver support are very, very important. If you are working on your liver, if your liver is sound and helpful, that is, if the person already had the fibroid now. The 2 things you are going to work on, it's not only the fibroid you'll be working on. It's not only the fibroid. You will work on the fibroid and also work on the liver. Because if the liver is having problem, every other organ in the body has problem. Because the liver will have to filter everything and supply nutrients to every part of the body. And at the same time, even when somebody is having a problem again with this fibroid, it has a lot of, or if you have a very bad liver, the hepatic portal vein that carries undigested food from the small intestine to the liver may also have problem. So it will now look as if the person is having umbilical hernia. Let's go for that. Risk factors. Women are more likely to develop fibroid, yes, if they have a family history of fibroid, if they started menstruation early, if they consume high amount of processed food, if they are overweight, if they experience chronic stress, have low intake of fruit and vegetable. You can see when you take low, when you are the type that doesn't like fresh fruit, my dear, expect a problem, expect fibroid. Because they will say, I don't like it. I beg, give me rice and meat. Give me rice and this. Give me this and that. You are not helping yourself. That is even, I kept telling us that our body is a living machine. This living machine there are some things the living machine needs. When you are working on your generator, if your generator is not serviced, probably after 3 months, you start feeling the sound of the generator. The generator will start misbehaving. So maybe the generator will need oil, or probably you have to remove all the oil in the generator and put new ones. That is what we call servicing. Your body too, as a living machine, needs servicing. I want to tell you, when you wake up every morning, if you don't brush your teeth, you don't feel comfortable. Even when you are brushing, when you try to bring up your throat, you actually try that. If you cough, when you are coughing, if those things come out, you find out that those ones that you cough out, the mucus that come out due to your brushing, is actually more dirty than the one here. So all those things that are dirty there has a lot of detrimental effect. I will advise that since there is mango paste, you should be using mango paste at least once every week, everybody. Mango paste once every week so that you can live long. It assists you clean the gastrointestinal tract. And it will also allow the rate at which nutrients is absorbed to your body to be increased. Let's go further. Okay, now symptoms symptoms vary from person to person. Common symptoms include heavy and prolonged bleeding, menstrual bleeding, severe menstrual pain, low abdominal pain, pelvic prayer, frequent urination, pain during intercourse, enlarged abdomen, constipation and bowel discomfort, fatigue and weakness. Some women may have a fibroid without any symptoms. Some may have fibroid without symptoms. Like some people will tell you, some doctors will tell you, there's no woman that did not have fibroid. There is no woman that did not have fibroid. It may actually be true, but the development depends on the lifestyle of the woman. Fibroid can affect fertility, but not all fibroids can cause infertility. The part of fibroids on a woman a woman's ability to conceive and carry a pregnancy depends on the sizes and number of the fibroid and the location. We have now interference with conception. Fibroid that grow inside the uterine cavity or press against the fallopian tube can block the movement of sperm and prevent fertilization from occurring. You know, if the fibroid press fallopian tube, my dear, there is no way egg will come out now. The eggs actually has to travel from the ovaries down here to meet with the sperm. That is the reason why in most cases, if the fibroid develop in such a way, that in most cases, most ladies that normally have ectopic pregnancy, they have one challenge or the other. They may not know that the fibroid is there. There may be a very tiny fibroid that actually block the fallopian tube. So when the sperm just try to swim, the sperm is actually busy looking for egg. So when the egg now meets the sperm inside fallopian tube, that is ectopic pregnancy. It's also, there must be a reason why the movement of the egg could not meet with the sperm inside the uterus. There must be a problem. There must be something. Maybe the person has built a lot of fat inside the fallopian tube, or maybe the lifestyle is very poor. Maybe there is a very tiny rudimentary growth there like fibroid. There must be something. It doesn't just happen. A wrong lifestyle also causes that. Cold water intake also causes that. Difficulty with the implantation. When fibroid distorts the shape of the uterus, they can interfere with the implantation of a fertilized egg, making it difficult for pregnancy to occur. Increased risk of miscarriages. Large or multiple fibroid may reduce blood supply to the developing embryo, increase the risk of early pregnancy loss. We also have pregnancy complications. Fibroid during pregnancy can lead to pain, bleeding, preterm labor, that is preterm labor or abdominal positioning of the baby in some cases. When a fibroid patient is eating right, when you are pregnant, if you are eating or before the pregnancy, you started eating right, the fibroid must have been softened. Our FOHOW product has the ability of softening the fibroid because the fibroid is formed in layers. They develop every month due to your excess secretion of estrogen that is not being shed out. Hormonal imbalance and infertility and fertility. Since fibroid growth is linked to hormonal imbalance, especially excess estrogen, this imbalance may also affect ovulation and menstrual cycle of the patient in question. So it causes menstrual infertility. Not all cases prevent pregnancy. Many women with fibroid conceive naturally and deliver their babies naturally. I have a lot of those people. Early detection and proper management are key. So, and another thing is that when you eventually enter menopause and the fibroid you have is not perfectly treated, it is certain that it will be reducing gradually. It can only reduce gradually after when you enter menopause, when the estrogen secretion already is already low. It can actually reduce if you are living right. If you are not living right, you suffer a lot of pains when you enter menopause. Key message here, fibroid do not automatically mean infertility. With proper lifestyle, management, natural support, and medical guidance, when necessary, many women can still achieve healthy pregnancy. Natural lifestyle management. Now, let's go further. Lifestyle changes are essential in fibroid management. Eat more vegetables and fruit, please. Note this, everybody. Eat more of vegetables and fruit. Reduce sugar and red meat. Avoid processed food. Reduce the rate at which you go to Mr. Beast, all these tantalizers, because what they use in preparing their food may not actually help you. Avoid processed food. Drink plenty of water. Thank God for water magnetized device. Exercise regularly. Manage stress and sleep well. Okay. Why is FOHOW product important in this treatment? It focuses on treating the root cause of the fibroid, supporting the body's healing ability. It restores hormonal balance, detoxifying the body, improving blood circulation. This approach is safer and support long time, Now, let's now go to the main. I want everyone to take their biro and pen so that I can give you this clue. I'm rounding up. For our products for fibroid support. I told you we have a lot of experience in this field. When you want to treat your fibroid patient, please, from the beginning of your treatment, let them know that they need a lot of sanguinora. Hello, are you there? They need a lot of sanguinora. But before the person takes the sanguine, my dear, please place the patient in question. Please, everybody, mute your phone, please. Mute your phone. Let's be muted, I beg. Let's be muted. So when you want to help yourself in the system, please, I will advise that you should start with hot water. The patient in question must start the day with hot water. After you must have done, you have to do 10 deep breathing first. Breathing in and breathing out first. That is for your fibroid patients. Because most fibroid patients, the rate at which they are so upset and worried because of the fibroid gives them hypertension. Many of them don't know they are hypertensive. Because if they are hypertensive, there's nothing they take for the fibroid that will work. At the moment when BP is high or BP is fluctuating, there is nothing most patients take without subsiding the blood pressure. Because all these things we are taking has a lot of role to play with the neurons of the brain. It's the neurons of the brain that will send signal to the fibroid. You are the one we are targeting. You are the one we are treating. Now, this must work on you, But when the brain is not well relaxed, when the blood pressure is high, my dear, you are likely to have problem with the patient you are treating. They will tell you, they've been taking this. It's not working. It's not working. That will be their complaint. So I want to please tell you, let them start their day with 10 deep breathing. When they start their day with 10 deep breathing, they should go and brush their teeth after the 10 deep breathing. When they brush, they will expel a lot of mucus. After the 10 deep breathing now, they should have hot water. After brushing, they should have at least 2 cups of hot water of about 75 cl. Hot water of about 75 cl. They should drink it. After drinking that, my dear, the next thing they should do is to start take sanguine aura. And when it's a case of multiple fibroid, please, I want to beg you, the more the sanguine aura the person takes, the better. Don't say they should take 2 bottles. 2 bottles is too small. It's just like someone that is very thirsty. If someone is thirsty and you give the person like 5 mils of water or 30 mils of water, the thirst may not be quenched. But if you give the person 1 bottle water, the thirst may be quenched. So the more the mils of the sanguine the person takes, the better. Okay, now when the person takes, let's assume the person takes at least 1 packet of sanguinora, you wait for nothing less than 1 hour 30 minutes. After 1 hour 30 minutes, give the person FOHOW tea and mango paste. Give the person 1 FOHOW tea and mango paste. I think you know how to prepare that because of our time. Now, after the 1 hour 30 minutes, please, you have to give the person 1 hour after that. You can give the person cool down liquid. If you have any other product that cures infection, we have one in the office. You give the person immediately after 1 hour 30 minutes of taking the sanguine. The tea and mango paste. So I want to tell you by His grace that cool down is the last thing the patient will take in the morning on empty stomach at intervals. Let's assume you have your other product that you have missed, maybe that has a bitter leaf, that has this or that. If you follow this procedure, your fibroid patient will not emaciate while the treatment is on. You give them, you can actually have a blended fruit. If that is not available, give them a blended fruit like blended cabbage and carrots. Blended, you can actually make a fluid from sesame fruit, from flax seed, from what do you call this thing? What's the name of this fruit of this thing? Meanwhile, I will remember later before we finish. So you make a kind of juice, it may have cinnamon, yes, with cinnamon. You blend them together, or probably make a kind of like, you are taking water, you're taking mango paste and tea. So after about 1 hour again, you take another mango paste and tea. And you take that tea, that herbal tea you prepared, you take it. When you take it, immediately, if the person is an ulcerative patient, please don't give the person cool down on empty stomach. But if the person does not have ulcer, you can actually go for cool down. In my own case, those that have this challenge, that are treated, I give them half bottle of cool down mixed with like half bottle of 75 cl bottle water. Excuse me, please. So another thing you have to do, immediately after that, about 1 hour after that, I want you to please follow this procedure. Mix salvia extract in warm water. Dissolve about 4 tablets of salvia extract in warm water and 2 capsules of Ganoderma. Melt it in warm water. Let the person drink. You know, these things are still empty stomach. Okay? So when about 30 minutes or 1 hour later, the person can now have the breakfast. When he or she takes the breakfast, you can take, you can now use like 5 or 6 capsules of garlic oil. Don't give them calcium at all. Don't give your fibroid patient calcium at all, because you want the fibroid to be soft. You want it to be succulent, so that it can start bringing a kind of exudate from the vagina. Okay, and lo and behold, don't tell your fibroid patient to go for scan after a month or 2 months. No, the fibroid will have to be soaked with all this. When it's soaked, it will be swollen, as if you put bread inside water. When you put bread in water, the bread swells up. So when you are working on this benign tumor, it swells with time because it softens the whatever in layers. That's the reason why you start seeing those exudates coming out from the person's vagina in layers. You see some like bunch of tissue paper. You see some like kuli soaking water. You see some black and the rest of them. So the conclusion of the whole matter is that when you are now treating this patient, let the person repeat that in the evening, but without FOHOW tea. Because if the person takes FOHOW tea in the evening, it may affect the person's sleep. FOHOW tea is actually not recommended to be taken very close to bedtime. If not so, if your sleep is interrupted, is interfered, you may, the future tea, the content of FOHOW tea, has a lot of role to play in sedating you. So that's the reason why you take it only in the morning, so that you will not sleep and be counting ceilings in the night when you are sleeping. So now, when you finish that in the morning, remember, you can see now I did not give the person blood cleanser. The reason why I did not give the person blood cleanser is because you don't give blood cleanser to a fibroid patient. It's detrimental. Okay, now let's go further. When at night now, in the evening at night, you wait about around 6 p.m. before the person takes the dinner, or maybe around 5, when the stomach of the person is already empty, between 5 and 6, the person should mix that Ganoderma again with salvia extract and take it on empty stomach. Another thing, oh sorry, I forgot, you must add long glue capsule in the morning too. Long glue is supposed to be 2, 2, 2. Long glue is 2 in the morning, 2 in the afternoon, 2 at night. When you now get to bed, you now have to tell the person everything the person is taking the person must have finished taking it between 6:30 and 7. Because the patient will have to stop drinking water between 6:30 and 7. I mean like 2 to 3 hours to bed. Even if the patient is dehydrated, the person should not drink water. That's the reason why the person needs a lot of magnetized water during the day. When the person is already on bed, before she goes to bed, she will drink oral liquid, 2 bottles of oral liquid. If the person has money, he should go for 4 bottles. It depends on how buoyant the person is. So the health will not be affected at all. The skin will keep glowing throughout the course of the treatment. Now, when you are now on bed, I want to please tell you, if you have vaginal gel, please keep that vaginal gel. Don't just throw it out anyhow. If you discover something that most of the vaginal gel in Nigeria now, according to NAFDAC, it has expired, but it's still very effective. It's still extremely effective. If you know you are treating those that do not want to understand, you can actually apply wisdom by using methylated spirit to clean the body, the expiring date out of it. They also wrote the expiring date on the sachet too. You can clean the expiration date. So at night, when the person is already on bed, please let the person put the Botox on top of a pillow and inject at least one vagina gel into the vagina while the Botox is on top of a pillow. This thing has a lot of role to play in curing anything that has to do with infection, and also softening the root of the fibroid, the attachment, the root of the fibroid attachment to the uterus. So when you are doing this every day, the person, this vagina gel continue every day. On the 4th day, on the 5th day in the morning, the person will insert the first goofeball. Hello? on the 5th day in the morning, the patient in question will insert the first goofeball. That goofeball has to be there. In fact, most of them, most of them as the fibroid falls out from the 3rd day in the evening to the 4th day. If it falls out, no problem. It's not a problem. If it falls out anytime between the 3rd and the 4th day, you can let the person wait for another 2 days and put another one. The rate at which the fibroid will start peeling, will start coming down, yesterday will start coming, will be very high. Hello. So later, after about a month and 2 weeks, the person can now start taking calcium, because you want the person to conceive between 2 months and 3 months. The fibroid must have been very soft. You cannot start giving the person calcium. Why are you giving the person calcium? You are giving the person calcium because you want to replace and restore the amount of zinc in our body. You want to boost the vitamin E. You want to help, build up magnesium. You want to give the person all the nutrients that will allow the person to be fertile. So when long glue is there and the calcium is there later, that's about 2 months, about a month and a half to 2 months of consistent treatment. I want to please tell you, the person will be pregnant with ease. Another thing you need to do, Samba Ora, we have to come in. Samba Ora comes in and replace Sanguine Ora after the first 45 days of the treatment. You can see that it's very expensive, but the patient in question will thank God for this. Now, if you see the chart I also put blood cleanser. Blood cleanser comes in immediately after the person finishes her period. When the period finishes, after a month and after 2 months, because there is always secretion on the network of blood vessels. You are preventing the person now from having pregnancy-induced hypertension. Because when there is hypertension, my dear, the pregnancy, she can miscarry the pregnancy. So about 45 days or 2 months into the treatment, you now tell the person to start taking blood cleanser. That is after the period, after the 2nd period into the treatment. I want to wish you all the best. God bless you. See you tomorrow. I think we have a training tomorrow. We have to see a training in the afternoon. God bless you all.
Thank you so much. Please, what do we say to our great doctor?
Yeah.